New guidelines are expected to be announced in the coming days for healthcare workers returning from Ebola-stricken areas. The decision comes as governors in several states announced over the weekend they were instituting quarantines for aid workers returning from West Africa. Critics say that might prevent healthcare workers from traveling to help fight the Ebola outbreak at its source. Meanwhile, Texas Health Presbyterian Hospital in Dallas and the staff who work here have endured harsh criticism for weeks for their handling of the first case of Ebola in the U.S. But nurses who treated so-called patient zero, Thomas Eric Duncan, paint a different picture. 4 of them sat down with 60 Minutes to share their side of the story, their fight to save his life. Sedia Rose said before Duncan was even diagnosed, she feared she was witnessing Ebola, but didn't allow that fear to paralyze her.
As a nurse, I understand the risk that I take every day I come to work, and he's no different than any other patient that I've provided care for. So I wasn't going to say, no, I'm not going to care for him.
But Rose went on to describe that whether intentionally or not, Duncan misled them on his possible exposure to Ebola.
I asked, have you been in contact with anyone who's been sick?
He said
no.
Despite that, the nurses said everyone who cared for Duncan volunteered to be there.
Everyone volunteered.
Everyone was a volunteer.
Everyone, housekeeping, respiratory, physicians, nurses.
The nurses say they were by Duncan's side, not only giving him the best medical care possible, but holding his hand and comforting him. He died 10 days after being admitted to the hospital.
And it was the worst day of my life. This man that we cared for, that fought just as hard with us, lost his fight. And his family couldn't be there. And we were the last 3 people to see him alive.
The nurses also said while it's true the hospital was unprepared to deal with Ebola, it's partly because the U.S. as a whole wasn't ready. They cited unclear instructions on protective gear in the early stages. 2 nurses who contracted the virus from Duncan, Amber Vinson and Nina Pham, have both since recovered.
I believe in the power of prayer because I know so many people all over the world have been praying for me.
At least one of these nurses continues to self-monitor, but has so far been symptom-free. That 21-day incubation period is coming to a close, but these nurses say the emotional toll of fighting the Ebola virus will take longer to recover from.